New data suggests a growing outbreak of coronavirus infections among immigrants in U.S. custody. ICE says at least 317 people in its detention facilities have tested positive for COVID-19. A federal judge on Friday ordered the Trump administration release all minors from the facilities after calling them, quote, hotbeds of contagion. Now, other countries are accusing the U.S. of exporting the virus through its deportation policy. CBS News immigration reporter Camilo Montoya-Galvez has been following all of this closely, and he joins me now from Kenville, New Jersey. Welcome, Camilo. If you could explain the emerging situation across U.S. immigration detention facilities and how ICE is addressing this coronavirus outbreak.
Good afternoon, Tanya. So at least 317 immigrants in U.S. Immigration and Customs Enforcement custody in detention centers across the country have tested positive for coronavirus. 35 direct ICE employees at detention centers have also tested positive for the virus. The agency, however, is not publicly tracking or disclosing cases among contractors who oversee most of the detention centers the agency uses to detain more than 30,000 immigrants. The agency during the pandemic has released about 700 older immigrants, detainees with medical conditions, and pregnant women, but it has so far resisted calls from advocates and lawyers to oversee a large-scale release of asylum seekers and other detainees who don't pose a threat to the public.
And Camilo, on Friday, as we mentioned earlier, a federal judge ordered the urgent release of minors from immigrant detention facilities. Tell us about the judge's findings and when these minors are likely to be released.
Sure. So this order on Friday is part of the decades-long litigation surrounding something that is called the Flores Settlement Agreement, which is a court settlement that governs the care of children in U.S. immigration custody. Over the years and over Republican and Democratic administration, Judge Dolly G. of the U.S. District Court in Los Angeles has said that the government has violated parts of this agreement. On Friday, she considered the risk detained children face during a pandemic, a global deadly pandemic. The government has released hundreds of children in the past 3 weeks, but Judge G said that greater speed is needed to remove these children from congregate settings where she says they face an increased likelihood of contracting the coronavirus. At least 59 unaccompanied children in the care of the Office of Refugee Resettlement have already tested positive for the coronavirus. Most of them, however, have been removed from medical isolation.
And what is their fate now? Do we know?
Right. So the order by Judge Dolly G on Friday requires both ICE, which detains migrant families with children, and the U.S. Refugee Agency, which cares for unaccompanied migrant children, to properly release them to sponsors who are typically family members here in the U.S., so they can practice social distancing with these families in their communities outside these government facilities. So far, the agency has released, like I said, hundreds of children, but the judge wants these agencies to move at a faster pace.
And Camilo, the Trump administration continues to expel thousands of migrants and asylum seekers, including children, under an order by the Centers for Disease Control and Prevention. You spoke with California Representative Norma Torres about this. She herself is an immigrant from Guatemala and the only Central American member of Congress. So this is, I would imagine, a personal matter for her. Let's listen to the conversation.
Are you concerned about this policy?
Absolutely. That really goes to the heart of American values. We don't deny due process to anyone, not within our country or at the border. I see myself in those children. I too came to the U.S., alone with my uncle. My parents stayed back in Guatemala. My mother was very ill with a heart condition that, my father had to stay there to care for her. So to think that these children are fleeing terrible conditions, and here we are saying, we don't care about those conditions. We don't care about the gangs that you're fleeing. We don't care that you have been raped. We don't care that your parents have been, potentially murdered, or a family member who was taking care of you. We just don't want you here, and we're going to send you back. It's cruel. It's inhumane, and it's something that the entire world has been watching, and it's giving Americans a black eye, not just here in the U.S., but throughout the world.
So, Camilo, tell us a little bit more about how the Trump administration is justifying this. I mean, it is essentially a shutdown of the entire asylum system for immigrants seeking asylum to the U.S., correct?
Sure, this is unprecedented, Tanya. Under this order by the CDC, border officials have been expelling thousands of unauthorized migrants and asylum seekers, including unaccompanied migrant children. This is a seismic shift in U.S. Immigration policy, because unaccompanied migrant children under an anti-trafficking law are supposed to be transferred to the U.S. Refugee Agency after they are encountered by border officials. But now border officials, citing this order by the CDC, are rapidly deporting them to their home countries or to Mexico. And they're doing the same for other immigrants who try to request asylum at the border. Border officials are telling us that this order by the CDC effectively overrides immigration and asylum law, Tanya.
All right. Well, Camilo Montoya-Galvez, thank you so much for joining us and telling us all about the latest on your immigration reporting. You do a great job. Thanks again.
Thank you, Tanya.